Patient safety is an initiative that has been really important to me since, frankly, I started my career in medicine. Hospitals and health systems have driven enormous improvement across any number of things. Events that in the past we didn't even think we could prevent. Now we're preventing them nearly 100% of the time. We also know that no amount of improvement is ever enough. And so if I've learned one thing in a year of traveling all across the country, visiting hospitals and health systems of every potential shape and size, it's that they are deeply committed to the safety of their patients.
Well, I've been a nurse for a very long time. Celebrated my 46th year, as a matter of fact, a few months ago. Nurses and clinicians, and really I have never met one person that works in one of our hospitals and health systems that isn't about the patient. It's exciting right now because we are in an era, I think, of change. We all feel it in healthcare, and we need to make sure that quality and safety is, front and center, as it always has been, but really with a renewed focus.
And so the question now was, given the rapidly changing and dynamic nature of our healthcare environment, what can we do to reinforce the message that we know to be true? America's hospitals and health systems care deeply about patient safety, and here's how and why. That's the foundation of the Patient Safety Initiative, and we spent several months throughout the year talking to hundreds upon hundreds of leaders within our membership to focus in on where they wanted us to drive improvement. So there are three foundational pillars. One is to focus on culture of safety from the board to the bedside. Two is ensuring that we are equitably measuring and driving change on patient safety outcomes. And then three is a laser-like focus on workforce safety. We know that we don't get to patient safety without a safe and well workforce, and we've done a lot of work in that space, as have our members.
This can't be additive. It needs to be iterative. We need to change what we're doing, improve what we're doing, but we can't add work. What we hope to provide at AHA is an opportunity and a venue for folks to come together and really learn from each other. And, the best case scenario would be better outcomes in a simpler way, perhaps taking some of the redundancies or some of the things that we can out of the system that will help make care safer. And also our caregivers can then have perhaps a little more time to do the things that really are meaningful to them.
As AHA's clinical diet leadership team, Robyn and I could not be more excited to invite you to join us in the AHA's Patient Safety Initiative. We've spent decades in your shoes, and we are incredibly excited to be embarking on this initiative with our membership.
We know that you're busy. We know what it's like, in your daily work life and how challenging the past few years have been. But we know how committed you are to patient safety and to workforce safety. So we really want our physician and nurse and caregiver colleagues to join us and help make our healthcare system better for all of our patients.